I mean, let's start with the benefits. The benefits are massive. So far, there are many areas in healthcare where there's a one-size-fits-all solution that is being taken. That is, the same intervention is given to many patients, on average works, but in many cases, patients do not respond as we expected them to. By taking a stratified approach, by identifying ex ante who would benefit the most from one treatment versus another, we'll be able to give the right treatment to the right individual at the right time. By doing that, we'll maximize population health, i.e. we will prevent unnecessary treatment for some individuals and use the resources that we are saving, shifting them towards alternative utilization that might help those individuals who are not currently being treated. But there are risks, and those risks relate, for instance, to the hype that at the moment is surrounding precision medicine. There's a lot of news about success cases, but we really have to remember that before we test these treatments on patients, we have to undergo seriously robust clinical studies to make sure that we are not confounding results, we are not finding chance findings, and because otherwise we'll end up damaging the health of some patients. So we have a lot to go, but we are doing the right things at the moment. Well, for patients it means a lot, because nowadays HTA takes the patients at the center of most of the decisions. For example, in my case, at NICE, patients are invited to share their experience. They are at the table together with a committee, and they share their experience. They tell us what it means to have a particular condition, what it means to receive that particular treatment, whether that treatment they are on has worked for them, why, and so on. And that information is then captured in the decision-making process. So having a decision-making process that is based on big data, like in Harmony, information that can then be used to make more targeted decisions for the right patients will definitely benefit those patients, because we'll have more certainty, potentially, as to what can work for someone.